Hello, we are here today at this great AT conference and the first session of the conference actually started yesterday, and it was about the diagnostic challenges and also some unusual cases of AT. And in this important session, lots of experts came to speak about AT and also the spectrum of AT, that it's not really a classical or more variant AT, but more of a spectrum. And this spectrum also means that there's a lot of diagnostic delay still for patients. The expert also mentioned that in this case, a prognosis of AT is still more difficult than a diagnosis of AT. And they did also mention that neurological symptoms also occur in early childhood, also for variant AT patients. Everything together, they actually raised the question, can we learn some important lessons about the asymptomatic patients that are now being diagnosed via newborn screening for SCID? So newborn screening for SCID actually has as a secondary finding that AT patients can also be identified in an asymptomatic phase of their disease. And this raises actually lots of questions as well. For example, can these asymptomatic patients now, for example, be treated with other forms of therapy, for example, stem cell therapy? The expert mentioned that this should be considered with great care because published results are not completely clear about this yet. In addition to these sessions, it was also mentioned that AT does not yet at this point fulfill the Wilson and Jungner criteria. So newborn screening for AT is still met with quite some hurdles and challenges. We still don't have an optimal test for it, we still don't have an optimal treatment for it, but we should perform more research and we should collaborate on big databases to actually get this kind of data together. In the final two sessions, we also heard something about a cohort in the UK in which they investigated immunological changes in patients before the age of 2. And they also saw that these patients actually did not encounter that many opportunistic or severe infections. And in the final talk, we learned something about an old biomarker that we all have heard of, the alpha-fetoprotein, and we had some new lessons about it as well, mainly that the AFP levels actually stabilize into adulthood. And if you see very high levels of AFP, you should definitely think that maybe something else is going on. But also that AFP levels can be very low or even in a normal range in newborns under the age of 1. So in this age category, normal AFP does not exclude the diagnosis of AT. And with all these great speakers, we actually have many more, we have one more day to go. So we are actually very excited to see what the rest of the conference will bring for us.